May 3rd, 2021 Health Committee meeting to order. We have all members present, so we have a quorum. We have approval of minutes from our April 5th, 2021 regular meeting. Is there a motion? Motion by Johnston, second by Chung. Are there any additions or corrections? Hearing none. Ms. Morlock, would you please call the roll?
Member Metzger,
Yes.
Member Chung,
Yes.
Member Johnston,
Yes.
Member Beer,
Yes.
Member Bloomfield,
Present.
Member Martin,
Yes.
Chairman Schaefer.
Yes, that passes. Do we have any members of the public for appearance today?
Chairman Schaefer, this is Camila, and we do not.
Okay, thank you very much. Moving on to departmental matters. First up is Jessica McKnight, Health Department Administrator.
Hello, everyone. You have my report. I have no items for action. Are there any questions?
Member Johnston.
Thank you, Chair Schaefer. Just a quick question. I did, in one of the articles I was reading this week, you had cited statistics for vaccination rates, and you had taken out, at one point you had taken out the children who were not eligible. And I was wondering if that's something that we wanted to pursue in general, or do you feel like that would be confusing so that once they do get eligible, then I just want to get your thoughts on that, because I thought that that was a really helpful way to look at like who's vaccinated and who's eligible.
So we were recently provided some good data from IDPH looking at different age categories, broken down by 5 years. And so that really helped me see even census data of what those age ranges were. And I think it is good to provide the public that picture of those eligible, how many are vaccinated, because we hopefully will have more that are eligible soon and that can get vaccinated versus the 172,000 that show up on IDPH's website, and only a portion of those are actually eligible.
Thank you for that question, because that was something that when you look around the state, you know, you have counties that have a much younger population, sometimes that might not be eligible, or they have a much older population that are eligible. So it's just by going on total population is kind of misleading in a way as to how much, how many people really are vaccinated that can be vaccinated. And hopefully later this summer that the 12 to 16-year-olds will be able to be eligible too. So any other questions? Member Chung.
Thank you, Chair Schaefer. Let's see, I guess my question right now, I guess the big story that I've been reading like nationwide is this sort of, I guess, now that the demand has been going down for the vaccines now, and I know that you have been opening up sort of walk-in appointments now, which definitely wasn't the case, say, even just a month ago. I guess I'm just wondering, you know, what I'm sure you guys have been talking about this at the health department, trying to figure out how we can get more people vaccinated. And I was also wondering if you know the sort of number of people that have gotten their first shot and never came back for their second. Like, have you been keeping statistics of that? And I guess, is there any way you can reach out to these people and be like, hey, come on in, get your shot? So any sort of, I guess, help with that would be great. Thank you.
Yeah, so unfortunately, I don't have statistics of how many people have not come back to get their second dose, but I believe IDPH is working on a campaign to reach out to individuals to, you know, remind them again, it's not too late, even if you're past that 42 days, it's not too late. Better to get that second dose. And you know, as you mentioned, we're trying lots of things. It almost was like a switch overnight from demand to waning demand. But our mass vaccination site at Grossinger Motors Arena is open to all Illinoisans. So beyond McLean County, and walk-ins are available. We've done drive-through clinics, evening hours, still visiting the rural communities, working with higher education, and also working with our partners to get in schools. So we're continuing discussions about what we can do for that remaining, 30 to 40%, which we knew would be the toughest to get. But, how can we make it more convenient for people if that's part of their hesitancy?
Any other questions? Member Johnston.
Thank you. I did want to say thank you to Ms. McKnight and the entire staff at the Health Department for putting on those after-hour clinics, for setting this up. You guys have been working tirelessly during regular business hours, but now to extend it in order to help the public. I just want to say thank you for that. So I appreciate it.
Thank you.
Chair Schaefer,
I have a-
Member Metzger has her hand up, and I know it might be hard for you
Oh,
to see
okay, I
it on
can't,
the
yeah, it's hard
screen.
for
I
me to see her.
apologize.
Okay.
Thank you.
Go ahead, Member Metzger.
I don't have a question. I just want to thank Ms. McKnight and your communication team for the document that you provided for the National Public Health Week. And I really did appreciate all of the breakdown of the areas that your team is responsible for. And I thought it was well done. So I wanted to thank you for that. And also, Ms. Poole put together, no, it was for Tammy Brooks, put together the Clinical Services Division. And she actually outlined a couple of things, some kudos, and I thought that's important to highlight. And so I appreciated knowing that your call center team is getting, those kudos. And also, I thought the funny stories were quite good also, so thank you.
I have a question, kind of piggybacks on Member Chung's question about the second doses. Is some of that because of like if somebody got their first dose at Walgreens, they got their second dose somewhere else, or they got their first dose here and then they went to some other state and got their second dose there? Is that part of the problem on it looks like people aren't getting their second doses, or is that actually really people not getting their second doses?
I believe it would be really people not getting their second doses now. Earlier on, it was more complicated or difficult to go from one provider for your first dose to another for your second dose. But now that vaccine is pretty plentiful, it's a lot easier for someone to find an open appointment with the type of vaccine they got for their first and just be able to get the second dose. Part of it could be just that kind of that hesitancy, fear of side effects. Though we know, being ill is much more of a risk than a couple of days worth of some side effects. Feeling that maybe you are protected enough, which again we know that the vaccine can help boost the immunity when you get that second dose. It's very important. So I don't think it's necessarily that, because IDPH breaks down the statistics by county of residency. So on their website, when it shows the percentage of the population, no matter where that a McLean County resident got the vaccine, it'll go into that percentage.
Okay, thank you. Anything else for Ms. McKnight? Okay, thank you very much. Next is on the page, Terry Edens from the Nursing Home Administrator.
Hello there.
Hi.
My camera's not cooperating today, so I apologize for that. So you just get to hear my beautiful voice. Okay, so you have the report in front of you. I don't have anything to bring forward, so if you have any questions, I'd be happy to answer them.
Questions? Member Johnston.
Thank you very much. I did have first I want to say thank you. You continue to put information in that's incredibly helpful in your packet. And I did have a quick question for you, and this is more just out of my ignorance, and I wanted to try to catch up some information. I know that in the midst of this past year, we've had Carl purchase Advocate Broman. And I was just wondering if with the transfer, with the purchase, have we been able to get into Carl's ACO as kind of a preferred provider? Or is that something that we're working on or at least seeking?
We are working on that. Actually, I was just talking to my team today about that. Unfortunately, they require you to be a 3-star, and we are a 2. So we're working very diligently to get those star ratings up. We were a 1, and now we're a 2. So we're on the right path, but we just kind of, got to keep moving forward. So yes, we are.
Okay, thank you.
Yes.
Member Martin?
Thank you, Chair. I was just curious where the status was with the blue ribbon panel. I mean, it's been some time since we've talked about it. I just wondered kind of where we're at with that. If you could kind of just give me an update.
Well, I would have to talk to Camille and Mr. McIntyre about that. They're the ones that pretty much set that up and just include me and your team as well. If we need to set one up, another meeting up, that's certainly fine with me. I appreciate the input.
Well, I don't necessarily need another meeting, but I mean, we could talk about it in June. But I just hadn't heard anything for a while. I realized COVID kind of put a halt to the the new branding and stuff that was involved in that plan. So thank you.
Yes.
Ms. Rodriguez, do you have anything you'd like to add on that?
Thank you, Chairman Schaefer, and thank you, Member Martin, for bringing that up. Ms. Edens, during her tenure, has never yet met the Blue Ribbon Panel in person. We have had at least one, if not 2, virtual meetings during her tenure. But certainly a lot of the momentum on some of those particular issues that you mentioned, like the name change and rebranding the institution, came to a grinding halt with all of the organizations' focus on COVID and infection prevention, et cetera. We were supposed to meet earlier in April and decided to pause and regroup and revisit some of the things that the panel had recommended and how maybe those recommendations might change now because of COVID, and then yet other things that are still in flux and being worked on. And one of those that we would love to update you on, being the Health Committee as well as the Blue Ribbon Panel, is the work to fill the empty wing with something operable that would increase census. And so Ms. Edens is underscoring how much she and her staff are meeting and working on this, but we are hoping that at least next month, if not the month after, we can update the Health Committee on where we are at with some really good operational changes that have to do with hospice as well as memory care. So I'll just give a little preview. We're working hard in that arena, and those were some of the things that the Blue Ribbon Panel suggested. So if you have more questions, I'm happy to try to answer, but we do still value the input of that panel and do intend to convene them in the coming months to give them updates as well as to get maybe even more of an updated recommendation if they'll give in light of how COVID has changed all long-term care focus.
Thank you.
Anyone else have a question? Member Chung.
Thank you. And thank you, Ms. Edens, for your whole summary and everything. I actually really liked reading about the nursing home week that's coming up soon. So hopefully I don't know if you'll share any of those sorts of things on social media or anything, or maybe the county government can do that. That would be just nice to kind of to see that those sort of activities. The one question that I have was that I looked back in, I think it was the March meeting agenda, or maybe it was the minutes that you mentioned that the sprinkler system was being upgraded. I was just wondering what the status is on that.
That is, they're currently still fixing that. Every time the poor guys, every time they go to do something, something else might break or they need another part. So, but they are still doing that, and everything is working fine. We don't have any issues there. It's just replacing some of the older parts. So yes, it is still kind of an ongoing thing, unfortunately.
So it was sprinkler and electrical. Was that what was both of those things were being like worked on at the same time? Was that my understanding?
Yes, they kind of coincided together, which kind of, sounds crazy, water and electricity, but I guess something to do with the panels in the ceiling. I don't understand it all. It's, not my expertise, but yeah, they are still working on it and everything is working fine. It's not affecting any operational things at all.
Okay. Thank you so much.
Mm-hmm.
Anyone else? I have a question. This kind of bugs me in a way. When you say that the residents continue to dine in their rooms and visitors are allowed in by appointments in a designated area, and I'm sure that these are guidelines or rules from IDPH. However, the CDC has come out and said, and you have said that all of our residents are vaccinated. So, and that they've come out and said that if you're vaccinated and your friends are vaccinated, you can get together and socialize and stuff like that. So I guess, do you foresee in the IDPH changing these guidelines in the near future, especially for situations such as our nursing home where all the residents are vaccinated, or all but one? Because I think that might help the morale, even though people are eating in the room and they can still see people. I think dining with someone else after a year of not doing it would be very beneficial to their mental health. So if you could give me some insight on that, I'd appreciate it.
Well, and currently, like I said, some of yes, they are still dining in their room. Not all of them. I shouldn't say they're all dining in their room. I should probably be a little bit more specific. We do have 3 dining rooms that are all being utilized. So all of them eating in their rooms? No, they're not all eating in their rooms. The people that choose to eat in their rooms can continue to do so. Our main dining room, however, is not open yet because it's just a little bit too close proximity for them to sit. But we've actually, National Nursing Home Week is next week, and our plan is for the following week to get a plan together to possibly move the residents who can choose and feed themselves back to our main dining room, because it's, the hardest part, I guess, is changing the whole dining routine again. So it's, it's a new thing for the residents, a new thing for the staff, and it affects every department. It affects, housekeeping of when to clean up. It affects dietary, of course, when to serve. It certainly affects nursing. So it's just, a matter of, it's not something that you can just say, okay, tomorrow we're going to do this. You have to kind of plan it ahead, and we're in the stages of that. But since National Nursing Home Week is next week, I don't want to mix all that together. That's just going to be too confusing. But we are having, actually, during National Nursing Home Week, we are doing a couple things in the dining room with everyone, staff and residents. Wednesday morning, we're having a buffet style breakfast, so that they will come through like a buffet type line, all the residents and all the staff. And then the same on Friday, we're having a cookout where myself and my DON are cooking, and they get to see that and go through the buffet line for that as well. So I should have been more specific. So I apologize for that. Not all of them are in their rooms. So
Good, thank you. Anyone else? Member Metzger.
Sorry. Your human resources and operations section, and you have needing management staff. I know what a ADON, that's the assistant director of nursing, but what is MDS?
that is the assessments that are required by CMS of all of our residents. It has to be a nurse, and it has to be signed off by an RN nurse, and that's actually the person who determines how much we get paid per resident. So depending on what programs they sign them up for and what the documentation that we do here.
So did we lose that individual, or we've always used a contract on that?
No, she left.
Okay.
Yeah, so we just need to replace her.
All
Right now, my director of nursing is doing it. So we're still being able to get everything done. It's just, a little bit more work for my director of nursing.
Okay, thank you.
Yep.
Anyone else? Okay, if not, thank you, Ms. Edens. Next up is Suzanne Scott, Adult Detention Medical.
Chairman Schaefer, this is Administrator Rodriguez, and at the last minute today, Ms. Scott did have to work the floor. As you know, they've been experiencing staffing shortages there. So I'd be happy to try to answer questions or at least take on the membership's questions about Ms. Scott's report. But I will say while I have the floor that she was very excited to report that they did hire an RN who started on April 12th. So they are slowly but surely getting their staff up and running. But surely her leadership has shown to be true, that she has to roll up her sleeves and sometimes work the floor. So I'd be happy to answer questions.
Thank you. Nursing shortage is very acute everywhere. So I can understand the issues that either the health
Chairman Schaefer, I don't know if you can hear us, but your video and audio have frozen. I'm not sure if Member Schaefer can log off or log back on, but I will also say that I believe without my paperwork in front of me that Ms. Bloomfield is the vice chair. So Member Bloomfield, Vice Chair Bloomfield, it looks like Member Schaefer is working to come back. If it doesn't work, I might need you to step in. So we'll just check for just a minute here and see if Ms. Schaefer is able to get back.
Absolutely. Thank you.
I don't think Member Schaefer or Vice Chair Bloomfield would mind if I said to the membership, did you have any questions that I could try to answer about Ms. Scott's report or that I could relate to her and get back to you on? Very good. Thank you. It doesn't look like there are any questions. Chair Schaefer, I'm sorry, are you there yet? I think in the interest then of keeping things moving forward, I would request Vice Chair Bloomfield to take on the meeting until Chair Schaefer can return. And that would be moving on to the action item that, oh, I'm sorry, there is no action item for adult detention medical. I apologize, Vice Chair Bloomfield. Moving on to Jason Tabb and juvenile detention.
Yes, thank you. Do we have Mr. Tab with us today?
Yes, I'm here. Good evening.
Good evening. Thank you, Jason. It looks like you have no items presented for action today.
I do not. You have my report in front of you. I would like to draw your attention to page 29 under mental health. There was a correction. The 3.5 hours of substitute were moved to March. I had them previously in February, but that was inaccurate, so I moved those over. I'd be happy to answer any questions about the report.
Thank you. Are there any questions for Mr. Tab?
No, thank you. Thank you, Mr. Tab. Moving
Thank you.
forward. Thank you. Agenda item E1, County Administrator Camille Rodriguez. You have it looks like you have a request approval of amended resolution establishing the basis for calculating the private pay rate. That's item E1A. You have the floor.
Thank you. And ahead of any discussion, I would respectfully request that you entertain motions, Vice Chair Bloomfield. Thank you.
Thank you. Do we have a motion to approve that item? Thank you, Member Johnson, seconded by Member Beer.
Thank you for that, Vice Chair Bloomfield. And there is a memo in your packet regarding this. In essence, administration noted that the formula with which we were using to establish the private pay rate was a bit antiquated, and we needed to modernize it a bit. And so this is to get us ready for the budget process and for those moments when we are bringing forth the private pay rate. And this was the best time than any to bring this ahead of all of those activities and recommend a different process. So administration would be happy to answer your questions.
Good. Thank you, Ms. Rodriguez. Are there any questions? No? Okay, hearing none. Ms. Rodriguez, did you want to address E12?
I do have one question. I'm sorry, Ms. Bloomfield.
Yes.
If we change this, what kind of impact are we seeing? Or what kind of impact do you anticipate seeing?
The impact won't be noticed as much other than more so being true to a process that's much more modern. If we utilized the 25-year-old method in place, the private pay rate in its calculation would be extremely high, much higher than the other long-term care facilities in the vicinity. And so in this sense, it allows us to be market competitive, but it's just much more commonsensical and allows us to survey the existing market instead of using this process. I hope that answers your question. Thank you.
So at this point, you don't know, but you anticipate it being more market-based.
Yes, and in this sense, it would be rolling up our sleeves and calling the long-term care facilities in the community or similarly situated counties with county nursing homes and requesting to receive their private pay rate, and then setting a private pay rate that is at the wishes of the board and so forth of the county board, the health committee, and then the county board.
Thank you.
And while I have the floor, I see Chairman Schaefer made it back, and thank you, Vice Chair Bloomfield. She picked up the torch for you, Chairman Schaefer. And we were, if you couldn't hear us, we were discussing the action item under County Administrator.
Okay, thank you. Yeah, my connection got lost, which that's the first time that's ever happened in all this time. So thank you, Vice Chair Bloomfield. So I assume that there's a motion on the floor and a second.
Yes, ma'am.
Okay. Are there any other questions? Okay, hearing none. Apparently, Ms. Morlock can call the roll then.
Member Metzger,
Yes.
Member Chung,
Yes.
Member Johnston,
Yes.
Member Beer,
Yes.
Member Bloomfield,
Yes.
Member Martin,
Yes.
Chairman Schaefer.
Yes. And so that passes. Anything else from the county administrator?
Yes, Chairman Schaefer, I do have under item E2A a small discussion to share with the committee about certified nursing assistants at the nursing home, if I may. We wanted the health committee to know that county administration has been working with nursing home administrator Edens on examining why we are having a challenge in filling certified nursing assistant positions at the nursing home. This is important because we noticed more and more usage of agency nursing. And, you know, as Member Martin noted earlier in our discussion, the Blue Ribbon Panel, that was definitely one of their recommendations to decrease the use of agency staff. And yet in this particular arena, we have not been successful. I think there are a number of reasons, but one that we noticed and that we felt we could make a change with was that the CNA starting pay was $5 less per hour than the rest of the local industry. So even though nationwide and statewide, and I would suppose countywide, there are challenges in hiring and keeping certified nursing assistants in general. It was even more difficult for McLean County government because of the lower pay. And so, Assistant County Administrators Dreyer and Taylor worked hard to examine the pay rate scales that we currently have and adjusted those to have the starting pay be more congruent with the local industry. And while we know that obviously this is about the nursing home, that type of action item to change the pay scale goes to the finance committee. So we have this under information because this week we will be taking an action item, a request to change the pay scale to our finance committee, and we wanted you all to know about that. I'd be happy, or the rest of the team here in administration would be happy to answer any questions that you might have about this information piece about CNAs.
Questions, Member Chung.
Yes, thank you. I know that this is an issue everywhere, like we've been talking about. I know I actually have a private student of mine, one of my violin students I've been teaching for forever. She has been doing the BACC program over at Bloomington High School for years, and she's now actually a CNA. And so a couple months ago, when I knew that, you know, that they were looking for CNAs, I actually mentioned it to her, and she didn't know that it was, you know, I said, well, you know, if you want a job, she was looking possibly somewhere else, and I think she actually is moving out of the area. But anyway, that's beside the point. But we were talking about it, and I thought, you know, if you wanted to, maybe you should look into this. So I don't know if, I mean, I'm sure everybody's been sort of brainstorming what to do. I'm sure that you have some sort of, at least I'm hoping that there's these sort of connections with the BACC program, but yeah, I guess I wanted to throw that out there because she and I recently had this discussion, and I don't think pay actually came up. So, but I'm sure that's probably what she was thinking in the back of her head too. But I guess I just wanted to offer my 2 cents there. Thank you.
Member Martin.
Just curiosity, how many CNAs might we be looking to hire?
Thank you, Member Martin. We need to hire at least 13. We have about 8 to 9, about 8 CNAs right now on staff, and we need about 13 more. Thank you.
Okay, I realize this is not for our committee to discuss, but doing some quick math at just at $5 more an hour, that's about 10,000. So we're looking at about $130,000 more to the budget. Is that what the finance committee is going to be looking at?
They are going to look at that, but also we have to consider how much more we're spending in agency. And so there's, while we will spend more money, we'll actually save money as compared to what we are paying agency CNAs, which without looking, I believe is around $30 an hour that we are paying to the agencies, whereas the starting pay for the increase would be around $16 an hour. And I'm not being precise here with any of the numbers or the exacts on the pay scale. And I've been handed a document here that I have to put my reading glasses on for. But with that said, I do know that, yes, this will be an investment, but we are also spending way too much right now, and it's hurting the budget on how much we are expending to the agencies.
Anyone else? Okay, thank you. Moving on to other business and communication, our next meeting, reminder, is on Wednesday, June 2nd at 3 o'clock in the afternoon, which is a departure from our normal because of the timing of exec and also the holiday with Memorial Day. So that is, wanted to remind everybody about that. If they haven't changed their calendars, please do so. Excuse me. Anyone else have any other business or communication? Nope. Okay, so we can move on to bills. And I have a letter from the auditor that she says that they've complied with all of our policies. And so first I have Board of Health has a prepaid total of $471,361.96. Is there a motion? Motion by Bloomfield, second by Chung. Ms. Morlock?
Member Metzger,
Yes.
Member Chung,
Yes.
Member Johnston,
Yes.
Member Beer,
Yes.
Member Bloomfield,
Yes.
Member Martin,
Yes.
Chairman Schaefer.
Yes. The next is Developmental Disabilities Board, and they have a prepaid total of $53,647.14. Motion by Johnston, second by Bloomfield. Ms. Morlock?
Member Metzger,
Yes.
Member Chung,
Yes.
Member Johnston,
Yes.
Member Beer,
Yes.
Member Bloomfield,
Yes.
Member Martin,
Yes.
Chairman Schaefer.
Yes. Jail and JDC Medical have a prepaid total of $32,171,000.79. Motion by Chung, second by Beer. Ms. Morlock?
Member Metzger,
Yes.
Member Chung,
Yes.
Member Johnston,
Yes.
Member Beer,
Yes.
Member Bloomfield,
Yes.
Member Martin,
Yes.
Chairman Schaefer.
Yes. And finally, the nursing home has a prepaid total of $272,911.80. Motion by Bloomfield, second by Martin. Ms. Morlock?
Member Metzger,
Yes.
Member Chung,
Yes.
Member Johnston,
Yes.
Member Beer,
Yes.
Member Bloomfield,
Yes.
Member Martin,
Yes.
Chairman Schaefer.
Yes. And if there is nothing else, then this meeting is adjourned.